focus on health now. The Health Minister Joe Phaahla this morning saying the pace of vaccinations has picked up significantly in recent weeks from the mid-August slump. Remember, the daily average was less than 120,000 jabs a day. On Wednesday this week, 265,000 vaccines were administered. But it's a big challenge to keep up that pace, particularly on weekends. I'm joined now by Dr. Nicholas Crisp, Deputy Director General in the Department of Health. Dr. Crisp, thank you so much for joining us this evening. So, a great vaccination day on Wednesday. Talk to me about the 7-day rolling average that you have at the moment. How is it looking over a sustained period?
Good evening, Sally, and good evening to the viewers. We've had a very good week with every day over 250,000. Today was 258,268. And yesterday was over 267,000. So things have picked up dramatically. We've been looking to see who's been coming for vaccination, and it's been in all provinces. But what's been very encouraging is it's not only the young people. The young people are obviously encouraging older people to come for vaccination. And we have seen a very big upturn in the 60-plus category in the Eastern Cape. So there's evidently a big drive going on in the Eastern Cape. So it is encouraging, but it's early days, and we do need to sustain this.
And talk to me about the weekends, because that's an area where people who can't get through to these vaccination stations during the week might have time on a weekend. Have we picked up pace there significantly? How much further do we have to go?
Yeah, so all provinces do have a few sites that offer weekend vaccinations, mostly in the big centres. There are challenges in finding staff for weekend vaccinations for a variety of reasons, but we do have some sites where volunteers come in and students have been helping, and some staff are allocated. After the 21st of July, when we started running out of vaccines and some sites didn't have vaccinations, we lost that momentum as well. So we'll see what happens over this coming weekend. Most provinces have been advertising which sites are open over the weekends, and they do send us copies of the adverts that they put out. So we'll see whether they're able to pick it up again.
Yeah, that will be great to see that really coming into the fore. So I want to talk to you about this issue that the Health Minister did raise this morning, and that is the discussions around whether South Africa would ever mandate the taking of vaccines, essentially making it compulsory to take the vaccine unless you have a jolly good reason not to. It seems that at this point, the Health Department is saying, look, it's not something we're seriously considering. What do you think? I mean, it is becoming more and more of a thing across the world. What is your view on whether we're going to have to get to that point at some stage?
Yeah, I think there's a big difference between making it a national mandatory statutory requirement and using the laws of the country to allow society to determine which workplaces and social places require people to have vaccinations. So we will exclude ourselves as citizens from certain activities, either social or otherwise, if we don't get vaccinated. We saw this with smoking legislation, and we've seen it in other places as well. But at this stage, the Minister said quite clearly, and the President has also said, they don't see it as a national statutory mandated way to go. And that's where we stand at the moment. We may have to look at how to make it mandatory in certain settings down the line, but at this stage, that is not on the cards.
All right. I want to talk to you about the latest COVID stats that have just come through. They've just been released. 12,045 new infections nationally. The deaths still really high, 361 deaths in the past 24-hour reporting cycle. KwaZulu-Natal of particular concern. It's showing 3,905 new infections. That's really high. That's leading the provinces, followed by Western Cape, 2,500, Eastern Cape, 1,700 odd, and then Gauteng, 1,100. So talk to me first about KwaZulu-Natal and this stubborn third wave that just doesn't seem to be going away quickly enough.
Yeah, Sally, we were looking at the figures. Every day we look at the figures, and I was watching the presentation again during the course of today and looking at those trends. So it's a very different wave from the previous waves, and I think it's largely because of the variants, but also to do with our behavior. As a country, we are getting a little bit fatigued from all the wearing of masks and social distancing and so forth. And that is what the virus thrives on. It's when we move around as people, when we're socially interactive, and when we take our guard down, that is when we spread the virus. So obviously Gauteng had a huge wave recently, and they are largely over it. And so it has moved from one part of the country to the other. And now it has, in the Western Cape, it looks like it might be over. But it's changed its shape. You know, the previous waves had quite straight up and straight down graphs to them. This one has gone up, and then halfway down it sort of turned and flattened, and we're not sure whether it is completely settling. And it's not quite clear exactly why it is behaving that way this time.
Yeah, it certainly has continued to show us flames, this virus. I want to talk to you about the pace of vaccinations. You know, things keep going well as they are. Do you think that by November, when we think a fourth wave might be hitting, we will see a significant impact from our vaccines? So talk to me first about what numbers you're expecting to have, how many jabs in arms by, say, mid-November, and then whether it will make a difference.
Okay, so I would like to say that each vaccination is a personal victory for the person who has the vaccination, because once you are vaccinated, you reduce your risk of infection. And if you get fully vaccinated, so either with one Johnson & Johnson or two Pfizer, and obviously we have a lot more Pfizer vaccine in the country than Johnson & Johnson, then you reduce your chances of severe infection, hospitalization, and death. And the figures that we've been watching very carefully over the months since the Johnson & Johnson in the Sosonke trial show us very clearly that if you are vaccinated, your risk is dramatically reduced. So each one counts. So in terms of our targets, where we would like to get to is to protect everybody over the age of 60. Now, clearly not everybody is going to come. So if we could get to 67, 68, up to 70%, that would be a real victory for us. If we can get 50-year-olds vaccinated, because those are the two really risky groups of the population where there's serious chance of severe infection and hospitalization in ICU and death. If we can get more than that, there's no evidence anymore that we will get to a real herd immunity, as we call it, or community immunity for a long time. And that's largely because this virus is mutating, and it just keeps changing its nature. But the more of us in any close environment who are vaccinated, the better. So our target that we are aiming for is to get to 70% of the adult population by Christmas. That's where we would like to go. And those are the targets that we have set ourselves across the provinces and with the private sector.
Yeah, so it sounds like we are once more on track for that, which is good news, and we just have to keep at it, as you say. Thank you so much for your time this evening, Dr. Nicholas Crisp. He's the Deputy Director General in the Department of Health.